The Dan Yorke State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
Good evening and welcome to my State of Mind. I am Dan Yorke. There's a lot of controversy about the vaccine, which is natural because we don't have enough to go around. So everybody is clamoring at trying to get in line and figure out who should be in line, priorities, right? Tonight we'll try to walk through reasonably what the data is, what the truth is, and what the recommendation should be. Earlier this week on Thursday, the COVID vaccine presentation was made, and there was a move toward age-based and get the 75-year-olds in, and let's make progress from there, correct? So the politics aside, let's talk about the data. First, we're going to run this story that is produced by Eli Sherman for 12 News and WPRI.com, which describes some of the latest coagulation with the pharmacy process that we have in the state. And then Dr. Pablo Rodriguez, who's expert and who is advising the state vaccination committee, will join Eli and me for the conversation.
Phase one of the vaccination efforts in full swing in Rhode Island, but who's eligible next, set to be revealed in a matter of days.
We are releasing our plans on Thursday, and of course we will update them as needed.
The debate over who will be included in phase two front and center over the last week, including whether teachers will make the cut.
Have you landed on where teachers will go yet?
So we've received input from all sorts of sources, including our Rhode Island Vaccine Subcommittee, and we'll release some further details on Thursday for sure.
While we wait for that announcement, phase one is moving ahead. The state has been partnering with CVS and Walgreens to administer vaccine in nursing and group homes.
This week will be the halfway mark.
The pharmacies visit each location 3 times, each visit spaced 3 weeks apart. The state must provide enough vaccine for anyone in those centers, but not everyone wants it.
If they have extra, what happens with that?
What CDC opened to us recently was the opportunity to now defer vaccine.
The state will move any extra doses from the CVS Walgreens allotment into the state's own pool, allowing them to use it how they see fit. But the Department of Health says they won't have a total until the pharmacies finish their rounds.
It would be unfair for us to really try to gauge how much we would be taking back altogether.
So as I told you, we are really lucky to have two bright minds on this, and hopefully by the time we're done with this conversation, you'll have a little bit of a sense of true perspective as to where we are with this battle against COVID and the rush to vaccines. In your top left is Dr. Pablo Rodriguez, a gynecologist by trade, a broadcaster. So there's no grass growing under Doc when it comes to communication. He's been with Latino Public Radio for a long time and a real personality and high profile person in the community. Quite the combination, Doc, I got to tell you, as between broadcaster and doctor, and you're an activist and somebody who's been in the public profile. And below is the journalist that really has taken the lead in instructing the entire journalistic and other community with his data mining and his ability to break out numbers. Eli Sherman from WPRI.com has been not only doing his job, but I think creating a tremendous public service for the community. So thank you to both of you for joining us. Doc, if you don't mind, I'm going to ask Eli a couple of quick questions about the data. Eli, you're seeing some trends when it comes to the vaccine delivery. There's a lot of concern and sometimes hand-wringing, right, over how the state is getting its vaccine to the people who most need it. Before we get to priorities, talk to me about what the data shows now, if you could.
Sure. So right now, the state, as of Thursday, had vaccinated they'd administered about 82,000 doses to about 62,000 people. And so within that 62,000 people, about 20,000 had been fully vaccinated. Thought about a different way, Dan, that's, just under 2% of the state's entire population has been vaccinated through about a month and a half of this vaccine rollout. The state really started out strong. We had one of the first inoculations, I think, in the region, and we jumped out to a quick start compared to other states around the country. In recent weeks, we've kind of slipped. At last check, we were about number 27th in terms of first doses administered per capita. And some of the reasons behind that, we can get into that. You know, the state's plan is a little bit inflexible compared to some other places. They've been highly specific about who they're prioritizing. And also there've been a couple snafus along the way. So, they're trying to do some things now to try and speed up the process a little bit, bring us back in line with the top group of states.
Good. I want to get into some of this story that we just ran and the pharmacy role in this and how it may have gotten a little gunked up a little bit. But I'd like Doc's perspective on this as well. In an effort to kind of calm people, being not the student of this that you are, nor the expert in medicine that Doc is, but I've been trying, looking at my own research and trying to conduct an afternoon radio show every day. I've been trying to explain to people that one of the things that seems to have guided the philosophy here is to make sure there was a second dose for the people who got the first one. So when you see 48% or 46% of the vaccine going out, given that Moderna and Pfizer require 3 and 4 week lags, and you have to have a second dose or the first one becomes relatively ineffective. And given the federal problems that we have had in terms of guarantee of flow, it seems to me, Doc, to make sense, make sure you got the second one before you give out the first one. Yes?
Absolutely. And, it's worse than that, Dan, because at the beginning of this campaign, the federal government was telling the states that they had reserves for the second dose. So that's why people started, and Rhode Island was one of them. We started just gangbusters, distributing the vaccine. And then we come to realize that there is no such reserve. After the election and the new administration comes in, there's no reserve, and the dosages that we're getting are the dosages that we're going to get. So this process from the federal government has not been terribly transparent. And when you ask the people in charge of the health department, they tell us, we only can distribute what we get. And it's very hard to plan when you don't know how much you're going to get.
Right, but the ratio, you look across the country and you see, the leading state is at 70%, in other words, what they have versus what they've injected into somebody's arm, 70%, right. But most everybody sits around the 50, 55, 48% thing. And I think it only serves to reason that some states like Florida have hedged their bets and said, all right, let's ram a bunch of first injections into people's arms with no guarantee of the flow. It's kind of a hedge. You're kind of betting on the flow. And I think Rhode Island, and I should mention, if I haven't already, Dr. Pablo Rodriguez is an advisor he's on the subcommittee for vaccine distribution, talking amongst other doctors and professionals to the state about this. I mean, there seems to be, in my mind, a proper conservative approach to just throwing first injections out there. Am I on the right track?
No, you are on the right track. And the other problem is that we have a number of partners that are involved in this distribution. Some other states have forgone partners and have taken the approach that they are going to run the entire operation. So right here in Rhode Island, CVS and Walgreens gets, close to, 40% of the vaccine at the beginning. But it was with one purpose, to be able to cover nursing homes and the staff and the people that are living in nursing homes. And by that measure, 100% of nursing homes have already been covered for the first dose. So they are being conservative because they're saying, we don't have enough for the second dose, so we're going to be holding back in order to have that second dose at the proper time.
Gotcha. So since Dr. Rodriguez mentioned that, Eli, flesh out then the rest of the story that you've written about in terms of some of the logjam. Read the pharmacies. What is that all about?
Yeah, so just as the doctor mentioned, the state has entered into the public-private partnership with CVS and Walgreens, which requires that they set aside a specific allotment of their weekly doses to that partnership. And the calculation that goes into that, Dan, is pretty rigid. Basically, if the federal government is counting doses based on facilities' beds rather than how many people are filling those beds, and then they double that amount for staff. So it's kind of, you look at the numbers, and they've given about 41,000 doses to this nursing home program, which I should mention has expanded now to other congregate living settings such as group homes and assisted living facilities. But that's 41,000 doses. Before the pandemic started, there were only about 8,000 nursing home residents statewide. So you get the idea that, you know, there are a lot of doses that are going towards this program that probably are just not being used yet because there aren't the people to give them to. And there's, you know, they're working right now. They've asked the federal government, this is the state, to be able to use those unused doses for other people if they know for sure that the nursing home residents are not going to need them.
All right, listen, summary on this, man, this ain't easy. When we come back, this controversy that has really bubbled up, understandably, about priorities with Dr. Pablo Rodriguez and Eli Sherman. Stay tuned to My State of Mind. We'll return. Back to My State of Mind, Dr. Pablo Rodriguez, who advises on vaccine distribution to the state, and Eli Sherman, who is really the lead journalist on not only the data, but the analysis on COVID-19 here. This argument that we have on priorities is seemingly natural. What we need to say, by the way, folks, is we have a press conference that happened, the COVID-19 press conference on Thursday. We're taping the show on Thursday morning, but we kind of know in general what the Department of Health is going to lead out with. If anything changes, you know, check in at WPRO and, of course, this show next week, and Eli on WPRI.com because you get day-to-day updates. You know, I liken this to a World Series or Super Bowl ticket or a concert that everybody wants to go to. Everybody wants a ticket, but not everybody can get it. And then you argue about who ought to, and then there's a lot of upset about, you know, who's elite and who owns who what. The difference is this is not a night of entertainment. This is life and death. And that's why things have accelerated. So I think there would be a natural, hey, me, yeah, how about me? How about me? From age, profession, socioeconomic, all those kinds of things. Yet we got to make some decisions. So, Doc, you're advising, and I know you're very, very, you know, focused, I think rightly so, on social equity and medical equity issues. So it's complicated. Give me your Cliff's notes on what you think priorities ought to be.
So the committee was charged from the beginning to understand the reasons we undertake this campaign. We are to prevent death and prevent hospitalizations. Those are the main reasons why people get vaccinated. The vaccine is not meant to prevent, you know, transmission, because, you know, we don't know if the vaccine prevents that. We do know that it prevents severe disease. And by that measure, we decided to first shore up the healthcare system and the first responder system. That's why we began with hospitals and first responders, which is 95,000 people. You know, it's a big system, you know, and 14,000 doses at a time. And from there, we're going to start moving then to the risk groups, 75 years old and above. We do know that age is one of the most important risk factors. After age 50, 98% of deaths occur at that time. So we need to consider the age. We need to consider the geography, because there are cities like Central Falls where every other person you encounter on the street is probably infected, and cities where that's not the case. So geography is absolutely important, and underlying conditions. We do know who are the people that are at risk of death and hospitalization, and therefore those are the ones that we are going to be concentrating.
Sure, and we're also talking about profession, and this is what's going on. So you know, the older crowd obviously is holed up. Well, in large part, a lot of us are holed up, but some have more access to technology than others, and we all know that this. Listen, COVID is awful. So COVID is near impossible. So we always have to go back to that point, right? Like we've never dealt with this before. So everybody needs to strap in and know that we're going to get there. But look, the professional rivalry, if you will, that's going on here now is we've been through the holy cow, some of the board members got it, which I think has been a red herring controversy. I really do. Do you want to speak to that? I know you're in the Care New England system. Do you have a thought on that before I ask Eli about the professional rivalry thing?
Many of the vaccines that have been given at the healthcare centers and at the hospitals are as a result of vaccines that were not going to be used. With every schedule, you have to thaw the vaccines, and if you do not use them, you have to throw them away. So the hospitals created a system whereby if there was vaccine at the end of the day, they were trying to figure out who else in the hospital system could we cover.
All right. And by the way, DOH guidance allowed for board members who were active in the hospital to be able to get a dose, not their families, not their friends. But Eli, we've got mixed messaging going on here in terms of teachers, what other professionals ought to be getting this whole thing. It seems to me that transmissibility is also a factor in this conversation. Not just who's more susceptible, but who is likely to transmit this virus. What's your thought on the professional issues there, in addition to all the factors that Dr. Rodriguez talked about?
Yeah, well, the doctor could probably give you an inside look at it, but just from the sort of the get-go of when they were trying to figure out who to give this vaccine to next, in phase 2, as in phase 1, as you guys have mentioned, it's really nursing home residents, healthcare workers, first responders, some high-risk inmates, and adults 75 years and older. The debate now, of course, has been who should get it after that, which is probably in the March, April range. And through the discussions in the subcommittee meeting that the doctor serves on, a lot of competing interests, because people like teachers, people with underlying health conditions, people who are work in supermarkets, who have been out there from the beginning of this pandemic, have had to work in person. They all feel like, hey, you know what? I've had to risk my neck going out there every day to work, and I should get the vaccine next. Now, the argument against prioritizing based on occupation, which is what the health department has signaled it'd like to do to move away from occupation-based prioritization, is that, as the doctor mentioned, really the deaths and hospitalizations that we see happen at the highest rate among people who are older, that's 60 years and older, and those with underlying health conditions. So if you were to protect that oldest group, you would in essence be protecting all of the most vulnerable people across all professions. Does that land for people who are interested in protecting their trade? Maybe, maybe not, but we're seeing that debate play out in real time as they're readying to make this announcement.
All right, so
but it will. That's the thing. The age-based criteria, it does protect the most vulnerable in all professions. So for teachers, it's going to be over 50% of teachers are going to be covered with an age-based and a risk-based criteria. And the studies about transmission in schools have been done. We have to base our decisions on data and on the science. And the CDC has already spoken about the transmissions in schools. There's a study in North Carolina that reviewed 9 weeks, 90,000 students, 32 infections in school. None of them involved students infecting the staff. That was compared to 773 cases that happened outside of the school. Same thing in Wisconsin, same thing in Europe. We do know where infections are happening. Teachers are safer in school than going to shop at the supermarket.
All right.
And I think one thing too, Dan, just to mention, is that when we saw last weekend, it was the incoming governor, Dan McKee, saying that he wanted to elevate teachers. And when you hear that, obviously teachers are very pleased with that type of signaling, but everyone who's not a teacher says, well, wait, what about me? And that debate can go on endlessly, right? Who who deserves to get a vaccine. It's a tricky decision to be made.
Yeah, no doubt. We'll touch base on the politics of this unique situation that we have in Rhode Island when we come back with Dr. Rodriguez and Eli Sherman. Stay with us. I wish we had another hour on this program, but we don't. Look, I'd like to give Governor Raimondo a big hug for her congratulations to become a cabinet secretary. I also think it's a disgrace that she's left this place 4 weeks without direct leadership and communication, and it's left a terrible void with the lieutenant governor, kind of stuttering into this deal. Doc, we got to shore up the leadership on this. Do you agree?
No doubt about it, but we have to base our decisions on science, not on politics, not on what makes sense, at any particular moment if you don't have all the information. This is about peace of mind for some people versus rest in peace for others.
Okay, well, see, I told you, the broadcaster in him would come out here. Eli, final word on this. Not that you're Dr. Fauci, man. I'm not gonna put that pressure on you. But what's your best guess based on data and the president saying, hey, there's another 45 million doses being released nationally yesterday and another 10 million a week, coming to the country. What's your best guess on when things are going to calm down? And I got like 30 seconds to get there.
In terms of getting the vaccine out?
Yeah.
Yeah, I think that, it's going to be tight for a while. A lot of eyes on the Johnson & Johnson vaccine, which is a big trial announcements coming out next week. And the CEO and president of that company has indicated that they could get in 100 million doses by the end of June. And that's only a 1-dose vaccine versus Moderna and Pfizer, which is 2. So that could really speed things up.
Yeah. All right, guys, thank you. You've been a great resource, and I will be checking back in with you. Dr. Pablo Rodriguez, who advises the state, and Eli Sherman, who informs the state. I'll have a final word when we come back on My State of Mind. Stay with us. Look, we got to remain calm, and we got to remain kind, and we've got to be patient, and we're getting close. We're getting close. We'll talk to you weekdays 3 till 6 on WPRO. I'm back here next weekend on My State of Mind. Thanks for tuning in. Good night.